So I have a case study here. It's one of my favorite cases. So for as with most people, when you're looking at a candidate for refractive surgery, um, you want to look at their manifest refraction, ocular health, to make sure there's no contraindications to surgery. And one of the big things for me is lifestyle and really understanding what a person does, not only for their job, but what are their hobbies. And this particular patient was really into mixed martial arts. And initially, we kind of talked about an ICL versus Smile, and I felt that Smile was like the better option because they were really into mixed martial arts. And we looked at this person's cornea. Their cornea looked great, and there was really no reasons to not consider Smile. And what I really like about this video, the audio is not on, but here you see me, using the new centration to line things up. It's much easier now to center on the vertex. And then you see, I just pressed the button. So I just put suction on, and now as soon as suction is on, I mash on the pedal, and the case is going. And so what's funny about this is you can't hear, but as soon as I finished, I said, "Oh, you're done," and he was like, "No way! There's no way you guys just did that." And then I just like the fact that the way the laser, it's really a slick laser. I think Dr. Gichuru talked about before the 500. If someone was kind of anxious in terms of feeling like they're in a MRI or something like that, this is much better. We have a window where people can watch the case, and I think that people really like this. But I think this is probably the bigger thing, is the dissection. So I've been doing Smile for a while, so I tend not to secure the eye with forceps. And with the 800, I mean, the lenticular extraction is so much easier. So you'll see here, I've just demarcated the posterior plane, and now I'm going to go in and, again, not holding the eye. I think if I did maybe secure the eye, it might be a little bit faster, but I find that patients are much more comfortable when I don't do that. And as you can see, the anterior dissection is really, really smooth. I like to go all the way around in the periphery to make sure there's no tags or anything like that. And then you'll see how I just easily slide posterior. And again, the delineation is very easy. I'm talking to the patient the entire time, and patients really have no issue with this at all. And what's nice is you'll see that once I've kind of broken up everything, just super easy, just with the forceps, the lenticule comes out really, really nicely. I mean, just beautiful. Postoperatively, this patient, I usually see them back. I do their cases on a Friday. I usually see them on Monday. This particular patient had some meibum in the pocket on the right eye. I washed him out, rinsed him out, and he was 20/20 the next day. But post-op day 3, 20/30, 20/20 after I rinsed him, but 20/15 in his left eye. And he was able to, probably this is the biggest thing. It's one of the things that I really liked about it in the military, but this person went back to sparring like 5 days later. And I do a lot of MMA fighters, and that's one of the things that they like. They can get right back to it pretty quickly. A lot of athletes really like it. 10 months post-op, patient was 20/20, 20/15, and this was their manifest. So overall, just did a great, he had a great result. He was really excited about it and was really happy about his result.